Today we will be discussing diarrhea, a disease of the lower GI tract. Diarrhea is an increase in frequency of bowel movements or an increase in the water content of stools. So it affects the consistency or the volume of the feces. If stool production is over 200 grams per day for adults, or over 20 grams per kilogram for body weight of children, then that would be considered diarrhea. The condition is very common. It affects millions of people in this country and around the world. And speaking of worldwide, diarrhea and the conditions it causes is the second leading cause of death in children under the age of 5. It is also the leading cause of malnutrition in this population. So therefore, it's a very important public health issue. There are different causes of diarrhea. One cause or type of diarrhea is osmotic diarrhea. As the name indicates, there is high osmotic pressure inside the lumen of the intestine, therefore it pulls more water into the lumen. The increased water efflux is due to the high amount of particles pulling the water in. In this case, we may see maldigestion as the cause. For example, if the sugary content of food is not digested, then the sugar particles will remain in the intestine, increasing the osmotic pressure. That will then pull in water into the lumen and increase the water content. Now, if we are dealing with osmotic diarrhea, NPO may help, because in this case, food is the force that's pulling water into the lumen. And there are other types of diarrhea. For example, secretory diarrhea. So remember that our digestive system has the function of secreting substances into the lumen like mucus, enzymes, and electrolytes. So we may not be eating a lot of food, but the GI system is still excessively secreting water into the lumen. In this case, NPO will not help because the cause of the diarrhea is not the osmotic pressure increasing due to food intake. So we need to really treat the underlying disease, such as a bacterial infection that is causing the excessive secretions. Some medications are known to cause diarrhea, so please review the table in Chapter 15. I believe it is Table 15.3 on page 391. One example would be of medications causing diarrhea would be the use of antibiotics, especially the prolonged use of broad-spectrum antibiotics. These can cause imbalances in the internal environment in the colon. And we know that there are a lot of different types of bacteria inside of the colon and that they form a specific type of environment in each person. And prolonged use of these types of antibiotics can lead to the proliferation of certain types of bacteria, such as C. diff. And C. diff proliferation is a very serious cause of persistent diarrhea. Unfortunately, this is a pretty common yet severe condition. In the clinical setting, when we see that there is a confirmed C. diff infection, there will be certain precautions and the patient will likely be in isolation with the warning precaution sign and the chart with what personal protective equipment to wear outside of the room. So you would likely have to put on, the gown and gloves and all of that before entering the room. Again, remember, if there's a sign on the door, please read it to find out what is going on. Not only could it tell you what precautions to take before entering the room, it may also tell you if a patient is NPO, and that would be important to know. Another thing that can lead to diarrhea is tube feeding. So this is one of the things we will need to monitor when we give patients enteral feedings. Other diseases may have diarrhea as a consequence and signs or symptoms, so they would need to be ruled out. For example, cancer. If it's cancer of the GI tract, it is very common that the stool pattern is interrupted, and sometimes people do have diarrhea. It could also be due to thyroid dysfunction and graft versus host disease. For clinical signs and symptoms, by definition, there has to be watery stool and increased frequency. And because GI infection is a major cause of diarrhea, depending on what type of bacteria or other infection the patient has, the stool, although already changed in water content, may have other changes. It could smell different, be really, really unpleasant smelling, just different from how it smells on normal days. Patients may report seeing blood in their stools, and this could be a result of a specific infection. But also remember that cancer can cause diarrhea, and cancer can also cause blood in the feces as well. So we really need to pay attention if this is something that a patient is reporting. In addition to these, patients may complain of abdominal pain and cramping, and also due to the high water content of the stool, the patient may have dehydration, which can quickly lead to weight loss, even in the short term. And this is because we know water weight can fluctuate very quickly. We mentioned earlier that worldwide diarrhea is a major cause of death for children under the age of 5, and many of the children died due to the dehydration caused by diarrhea. Children's bodies are sensitive and cannot regulate severe dehydration. So the World Health Organization, WHO, focuses a lot on preventing diarrhea and its related death. For the same reason, it's very common for patients to have electrolyte and acid-base imbalances, which could also be fatal. The medical diagnosis for diarrhea involves determining what the underlying disease is. As we mentioned, diarrhea can be the result of infection, side effects of antibiotics, or certain diseases such as cancer or the rejection of an organ transplant. Therefore, it is important to determine the root cause. We need to be checking the patient's age, hydration status, which would be a very important thing to know, especially when we are dealing with pediatric patients. Also, we would want to know if there is blood in the stool and check for immunocompetence. And we check this because just as we mentioned for organ transplants, recipients could have it. Also, patients that are immunocompromised may develop an infection that is rare among the normal or healthy population. For example, some people with prolonged immunodepression may be suffering from a fungus infection. So different medications other than the regular antibiotics have to be used. Otherwise, you won't be killing the fungus. And then we also need to ask about the pattern related to the time of day and food intake. Some patients may tell you that when they eat a certain type of food, they may have their symptoms return or get worse. And as we will see later, this is something we need to educate and encourage patients to monitor because they need to know what foods or beverages are triggers. So if that's the case, they will have to eliminate those food items from the diet, at least until the diarrhea is resolved. Stool cultures will tell the doctor exactly what bacteria or fungus is causing the diarrhea. So this is how we would know if it's a C. diff infection. we can test the fecal sample to see if it comes back positive for C. diff. We can also use an endoscope to check up there and see exactly what is going on. We will also need to assess for the osmolality and electrolyte content. The treatment is to target the root cause first. If it is an infection, then we would need antibiotics. But the use of antibiotics needs to be specific. It needs to be tightly controlled, of course, by prescription only. We really don't want to excessively use antibiotics if we can help it, because it will also kill all the good bacteria in the colon as well. And doing this could open the door to bad bacteria to overgrow, such as C. diff. We will also need to deal with the dehydration and electrolyte and acid-base imbalances, and we can do this with IV fluid. This therapy is very important. In many cases, it can be a life-saving intervention. And if it's a medication that is causing the diarrhea symptoms, we can use other medications to treat the symptoms. Or, of course, see if we can discontinue the one that is causing it. Also, part of treatment would be suggesting prevention strategies, especially because sometimes diarrhea can be associated with lifestyle factors, including certain food items. When it comes to nutrition therapy for diarrhea, the number one focus is fluid loss. Again, dehydration could be fatal. Also, imbalance of electrolytes like low potassium and low sodium, these should be corrected. We also need to assess for acidosis, in this case metabolic acidosis, meaning that our body is having abnormal metabolism and producing more acid or protons than we can deal with. So this could cause our body pH to drop, which may be fatal as well. Malnutrition is also common in people with diarrhea. They do have loss of water weight, but also the increase in stool frequency could compromise digestion and absorption. We mentioned that children are at high risk, but infants and the elderly are at greatest risk for severe complications. For the nutrition diagnosis in people with diarrhea, the problem is usually associated with losses or inadequate intake. In terms of intervention, in past diarrhea patients, in the past, we would have had them be put on an NPO or clear liquid diet. And we mentioned earlier that not all types of diarrhea can be resolved with NPO. And we now know how important the stimulation of the GI tract is. Although in certain cases NPO may be indicated, we do not want to leave the GI tract unused for a long period of time, as it might experience some atrophy. So we basically need to use it or lose it. And if we're not using it, it could open the door for other complications later on. So we need to have at least some stimulation so the GI tract is being put to use. There are also oral rehydration solutions, or ORS. This is used by the World Health Organization and is especially important in developing countries where it saves a lot of lives, especially for children. So depending on the situation, we may want to focus on decreasing the motility. If the GI tract is being too active, then this would contribute to the increase in frequency of defecation. However, if it is a bacterial infection, we may not want to do this because we want the bad bacteria to be flushed out of the body and not remain in the intestine. And with all of this going on, the increase in frequency and water content, and also many patients, that have diarrhea have a history of antibiotic use. Therefore, we may want to be using prebiotics and probiotics to restore the proper environment in the colon. Otherwise, diarrhea could become chronic and the patient could suffer from it for a long period of time. So this is the oral rehydration solution, or ORS, that was developed by WHO, or WHO, World Health Organization. And it contains more than just the commonly known electrolytes, like we have sodium, chloride, potassium, which are needed, but it also contains glucose. And this is included because for glucose to be absorbed, it requires a specific transporter in the small intestine. And that transporter, SLT1, actually transports glucose along with sodium into our bloodstream. So by giving glucose, it stimulates the absorption of sodium. So it provides the patient with some energy and brings in more electrolytes. This helps not only rehydration, but also restoring electrolyte balance. So you can see here that the formula, it's nothing really fancy or expensive. It's a really effective, low-cost, life-saving intervention. General principles for the nutrition therapy of diarrhea are summarized here. For meal planning tips, we mentioned that the patient may need to pay more attention to what food triggers diarrhea for them. And in general, we may want to limit foods and beverages that contain high amounts of sugar, lactose, fructose, corn syrup, and sorbitol. All of these could increase the osmolality in the colon significantly. We also want to avoid beverages that are caffeinated, and also having smaller, more frequent meals can help as well. So in addition to the general food recommendations of food to avoid, patients also need to pay attention to what foods cause their own symptoms and avoid them. Then for cooking tips, we see here clean, separate, cook, and chill. So this is basic food sanitation that we learned in ServSafe. The reason why it is included here is because many times the cause of diarrhea is infection, and it could be a foodborne illness. Therefore, food sanitation, how to properly cook and store food, is very important. So please review these as needed. These next few slides contain specific recommendations for each of the food groups. So please go through these and study these on your own.